I'm Harriette Van Spall, cardiologist and clinical trialist, and I'm here with Professor Tor Biering-Sørensen, a dear friend and collaborator, who is presenting with his teammates the electronic nudges to increase influenza vaccination among patients with a history of MI, which represents a pre-specified exploratory analysis from the Nudge Flu program. Welcome, Tor.
Thank you so much, Dr. Harriette Van Spall. It's always a great honor to be with you.
The honor is mine. Before we start the discussion on this fabulous analysis, which is being presented at AHA 2024, I wonder if you could provide a bit of context about the Nudge Flu program of trials that you have led.
Definitely. So the Nudge Flu trial programs that we've executed in Denmark through the last 2 seasons is an attempt to test which letters we should send during the seasonal flu vaccine season to figure out which kind of information we should provide Danish citizens to increase vaccine uptake the most. We have run 3 of these trials. The first we ran 2 years ago, where we randomized everyone 65 years and above to 9 different behavioral guided letters. And then we have run 2 trials simultaneously last season during the flu vaccine season, where we randomized those 65 years and above to 6 different behavioral guided letters. And then we also ran one amongst those who were 64 and younger with a chronic condition, so they also are liable for free flu vaccine, where we randomized them to 6 different letters to see which kind of letter do we need to send out during the vaccine season to nudge them to get vaccinated, which letter increases vaccine uptake the most. And combined, we randomized over those 2 years more than 2 million Danish citizens to test which letter actually matters the most and which letter increases vaccine uptake the most.
Right. So these were implementation trials that tested the efficacy of a nudge letter. Tell us what a nudge is.
Yeah. So a nudge, we experience it every day when we go shopping. We know that candy and certain stuff is placed very close to the cashier, trying to nudge us to purchase, these kind of products when we're leaving the store. So every one of us experience it every day. Here, we're just trying to nudge Danish citizens for a more healthy daily living. And that includes vaccination, because we know that flu vaccination prevents, clinical outcomes. And we also have evidence amongst patients with acute myocardial infarction that it actually benefits and potentially prevents future cardiovascular outcomes amongst patients with ischemic cardiovascular disease.
Right. And so you used the Danish registry platform to email these letters. Is that right? And then tell us about the goals of this exploratory analysis.
Yeah. So you're completely right. We used the nationwide Danish registries in combination with a quite unique email system that is linked to our social security number. So we can identify anyone in the registry that are liable for a free flu vaccine. And that's, the elderly, the 65 plus, but also the young individuals in Denmark from 18 years to 64 who have a chronic condition. There we then identified all of these Danish citizens and randomized them to different information letters, testing which nudge potentially included in this letter could increase vaccine uptake the most. For this specific analysis, we wanted to test which nudge letter might be more effective amongst patients who've had an acute myocardial infarction within 10 years prior to nudging them.
Right. And you identified those patients using diagnostic coding Yes, because they were linked, these
Exactly.
registries, patients to their past history and diagnostic codes. Okay. And so, do you have any regulatory or ethical considerations in doing this? Do people need informed consent to receive these letters, or is this a waiver of consent? How do you manage to recruit so many patients?
No, but that's a great question, and since it's just a letter, we don't infringe anybody's free autonomy, right? So the ethical committee in Denmark, they waive an informed consent, and it has to be noted that the Danish health authorities actually sent out, a letter using this system, the e-box system, the electronic email system that it is linked to our nationwide registries every year. And we just used their standard letter, right? And just changed one sentence. And the specific sentence that we're going to discuss here during our interview is the cardiovascular gain sentence, where we just included a sentence informing Danish citizens that besides preventing influenza, a flu vaccine can potentially also prevent cardiovascular outcomes. And we are hopefully going to talk about the results very soon. But that is, the only notch sentence that we actually came up with ourselves. Everything else came from behavioral science books about how we potentially can notch people. But that specific sentence was something that we came up ourselves because we are cardiologists, and we wanted to test whether informing about the evidence that we have linking flu and cardiovascular outcomes and the potential protective effect of a flu vaccine potentially could be a benefit and increase vaccine uptake.
Okay, so how many patients did you include in this analysis, and what were their baseline characteristics?
So because we included people from so just to start with, we randomized more than 2 million inhabitants. To be more precise, we randomized 2,146,000 Danish citizens. Among those, approximately 60,000 had a diagnosis code of an acute myocardial infarction within the past 10 years, which we used to define those in our population with a previous myocardial infarction. And as you know, it's a combination, it's a meta-analysis of 3 different trial populations, the 2 not flu trials, which was amongst the elderly, and then the not flu chronic trial, which was conducted amongst the young population with chronic diseases. Therefore, in the elderly population, we randomized everyone, right? But just to mention some of the comorbidities, we saw that approximately 3%, approximately 24% had a history of heart failure, and approximately 15% had a history of atrial fibrillation. So we saw a stratification of cardiovascular risk factors, typically for the elderly population in the not flu trial. Of course, the not flu chronic trial was specifically included because they had a chronic condition. So there we saw much higher prevalence of chronic conditions because that was the criteria for including them in this study, because they were liable for free flu vaccine.
Sure. So tell us your primary findings.
Definitely. So we saw that a notch letter significantly increased vaccine uptake, and combining all the evidence from all the 3 trials, we saw that any kind of notch letter increased vaccine uptake with 1.34%. Then looking specifically into the cardiovascular gain letter, we saw that it on a global population, so everyone who received a cardiovascular gain letter, we saw an increased vaccine uptake of close to 2%. But very interestingly, for the specific aim of this analysis, looking into whether our notching letters provided a differential effect on patients with a history of IMI, we saw that the cardiovascular gain letter significantly increased the vaccine uptake in those with a previous IMI, with a substantially greater effect. In those with a previous MI, it increased vaccine uptake with close to 4% absolute percentage points, whereas those who didn't have an acute myocardial infarction, it was closer to 2%. And this was significant. We saw that this was actually a significant effect modification in our analysis. So the cardiovascular gain letter is effective in any kind of Danish citizens who are liable for a free flu vaccine, but it's even more effective in patients who have had a history of acute myocardial infarction. And that is very informative news when thinking about how we can increase vaccine uptake in this specifically high-risk population, where we also have randomized evidence that a vaccine prevents cardiovascular events in specifically this patient population.
Sure. So a primary implementation endpoint showing the efficacy of the nudge letters, and in particular, the CV gain nudge letter, which informed patients about the benefits to those with cardiovascular disease. Were you able to measure the proportion of patients in your trial who were randomized who actually opened the emails as a surrogate for reading the letters and understanding the contents?
That's a great question, Harriette. And unfortunately, in our system, the e-box system, as soon as the letter has entered the e-box system in the Danish citizen system, it's private property, so we can't measure that. But since it's a randomized trial, at least we can see that, you know, the only difference between our different groups that we compare, that is whether they received a letter, right? So we know that it is causally related to the fact that we sent this specific letter. And as I mentioned before, any of our 6 different interventions that we sent were effective. However, we just saw that the most effective amongst the patients with acute myocardial infarction was the specific cardiovascular gain letter, right? So that is very important information to take out of this pooled analysis.
Sure. And you're only measuring the uptake of the vaccination in that season. Is that right? So all of the vaccination events are proximal to when the letter was delivered. Is that correct?
So we also assessed, you know, the time from receiving the letter or time from us sending the letter until they were vaccinated, and we saw that citizens within Denmark who received the letter, they were vaccinated within, you know, approximately 30 days following receiving the letter, and that of course would also be what we would anticipate, that it's within a very short time frame that these nudges potentially are effective.
Okay, so tell us how these findings are going to change the way your public health system nudges patients in the future. Have you integrated these findings into practice or policy?
It's a great question, Harriette, and I want to mention that from our first nudge flu trial that we executed 2 years ago, we saw, just like we found in this combined analysis, that the cardiovascular gain letter was the most effective. However, the other effective nudge that we found in that specific analysis was just sending a reminder. So sending information 2 weeks prior to vaccination and on the day of vaccination was the other most effective nudging strategy. And that strategy has actually already been implemented within the Danish healthcare system. So the Danish health authorities are currently sending reminders for those who are not vaccinated in the effort to improve vaccine uptake. So they implemented that change the year after we presented our first nudge flu trial. So that has already been implemented. I think adding a sentence informing patients about this link of flu and cardiovascular outcomes and the protective effect of a vaccine might be a little too extreme for the health authorities to implement. Beside the fact that we now have three different trials showing that it actually is a very, very important implementation strategy or nudging strategy to increase vaccine uptake, and it even seems more effective in patients with an acute MI. I also just want to add that we also saw that time since your acute myocardial infarction actually also had an effect on how effective this nudging strategy was amongst MI patients in our chronic part of the population, so those who were younger than 65 and had a chronic disease, where we saw a clear effect modification showing that it's much more effective if you had your MI recently compared to if it were several years ago. And that's also important to take away. So we need to tell our acute myocardial infarction patients that it's important for them to get vaccinated and provide them with the information, the link about vaccination and reduced future cardiovascular events, especially those who have had a recent MI, because it's even more effective in those patients.
Sure. Any plans to assess the differences in cardiovascular events in these two groups?
Definitely. Because this is a combination of three trials, the last trial we haven't, or one of the trials we haven't assessed the outcomes and we haven't published it separately, in a separate analysis, so we couldn't combine it in this specific pooled meta-analysis. But yes, definitely, and for those studies where we already have published the outcome results, we have seen very interestingly that it's specifically heart failure hospitalizations where we see a reduction in those arms where we see an increase in flu vaccine. So there is maybe something about the immune system and heart failure and vaccines that we don't really understand, because remember, here we randomized everyone who are liable for a free vaccine in Denmark. And when we see an increased uptake in vaccines, flu vaccines specifically here, then we see a reduced risk of heart failure hospitalizations. So interesting results, but we can't really answer why we see this trend, whether it's purely because of low numbers. That might also be an issue. Remember, we haven't powered these trials for clinical outcomes, but it's interesting trends that we see.
Well, Tor Biering-Sørensen, congratulations on another fantastic analysis on the background of these hugely successful trials that you have led and executed. Thank you for spending time with us, and good luck to your team on the presentation that lies ahead.
Thank you so much, Harriette. And I just want to say that it's Dr. Ankit Bhatt who will present these at HCA, and I'm sure he's going to do an amazing job.
We can't wait to watch his presentation. Thank you again.
Thank you.